is Michaela Hediger, and today we are going to be dissecting the heart. So, we're going to start with the outside of the heart. If you look at the outside of your heart, this is typically going to be wrapped in the pericardial sac, and then you'll have your coronary artery that's going to run on the outside here. And the job of the coronary artery is to supply the heart with its blood supply. And a blockage in the coronary artery would typically result in a heart attack if it was a complete blockage. When we're looking at the heart, the top is going to be referred to as the base. The bottom, or the more pointy part, is going to be your apex. So now we're going to open the heart up. Went ahead and did a cut down the middle. And so, just to start off, the blood's going to enter the heart through the superior and inferior vena cava. And its first stop is going to drop right into the right atrium. And then it's going to go through the tricuspid valve. And if you see these stringy-like structures, that is the chordae tendiae. Those are connected to the papillary muscles in the heart wall muscle, and that just helps those open and shut. And then the blood's going to go into the right ventricle, and then it's actually going to go up through the pulmonary valve into the pulmonary artery right here. It's a very defined structure, pulmonary artery. And then it's going to enter back in through the pulmonary veins. It's going to drop into the left atrium. And let me see if I can show you there. So that's just a good indication that you're in the right spot, left atrium. And then from there, we're going to go through the mitral valve, into the left ventricle. Now the left ventricle is going to have the thickest muscle because that is going to have to push that through the aortic valve into the aorta and out to the rest of the body, to the limbs and all the way back up. So this is going to require the most work, the thickest muscle, in order to pump that all the way up through this main artery right here. Now, when you're looking at arteries and veins, a good way to tell the difference is your arteries are going to be thicker, rounder, and hold up their structure a little bit more than a vein because of the job it has to do. The veins return deoxygenated blood to the heart versus the arteries are going to be pushing fresh oxygenated blood out to the rest of the body. So there's that. And you can kind of tell here we've got some fatty tissue on the outside of the heart. Again, over time, the human heart can develop fat, build up along the outside, and that will lead to heart conditions and heart issues as well. And let's just look again here at these chordae tendiae. The job of the valves are going to be to prevent backflow of blood into the previous ventricle or atrium. So when the blood comes in, drops into this first atrium, and then we pass this first valve, it's going to go through the valve and it's going to shut closed because we don't want any blood flow to back up into that right atrium. Same thing, it's going to go through that pulmonary valve, same thing, go through and shut. We don't want any blood lingering back in the previous atrium or ventricle. So that is the job of those heart valves. Okay. And our biggest artery of the body is the aorta right there, aorta. Our biggest artery in our body. Pulmonary vein. Pulmonary vein. All right. I'm going to put that back together. And that concludes our dissection today of the heart.